Welcome to today's webinar series entitled Getting Reimbursed, Updates on Billing and Documentation for Health Behavior Assessment and Intervention Services in 2020. Our presenters today are Dr. Stephen Gillespie, APA's Senior Director of Healthcare Financing, and Ms. Megan Duganhaus, APA's Coding and Payment Policy Officer. This webinar series has been pre-recorded and broken down into segments to make it easier for you to understand and refer back to. Our objectives are to understand the H&B code set review and revision process, to introduce the 2020 Health Behavior Assessment and Intervention Services, and we'll review the new CPT codes, descriptions, and coding structure, as well as provide an explanation of how the existing codes crosswalk to the new codes. We'll also apply the new codes using clinical examples and review coding guidelines, payment policies, and reimbursement values. In this segment of the webinar series, our presenters will provide an introduction to the 2020 Health Behavior Assessment and Intervention Code family. Megan and Stephen?
So the Health Behavior Assessment Intervention Services, they are used to identify and address the psychological, behavioral, emotional, cognitive, and interpersonal factors that are important to the assessment, treatment, and management of physical health problems. One thing that's important to note is that when using the HBAI services and codes, the patient's primary diagnosis is always going to be physical in nature. Now, a point to clarify, it does not mean that the patient cannot have a traditional mental health diagnosis. That can be a secondary diagnosis, but it's important to know that the primary diagnosis needs to be medical in nature and the primary focus of your intervention. In regards to the services, the assessment intervention focus, those services are going to focus on factors complicating the medical condition and the treatments.
As part of the code set revision process, a specific definition for health behavior assessment was adopted by the CPT editorial panel. And that new definition can be found in the 2020 CPT manual. As defined, it says that health behavior assessment includes evaluation of the patient's responses to disease, illness, or injury, outlook, coping strategies, motivation, and adherence to medical treatment. Assessment services are conducted through three required elements. Those three elements are a health-focused clinical interview, behavioral observations, and clinical decision-making. So effective for January 1, 2020, the existing codes for H&B assessment and reassessment 96150 and 96151 will be deleted. And on January 1st, a single code to report both health behavior assessment or reassessment will be implemented and should be used to report services that are provided on or after January 1, 2020.
In this slide, you'll see on the left-hand side the two codes that were used previously to capture both the assessment and the reassessment services. So the assessment service was 96150 and 96151. In the new HBAI code set, we've collapsed that, so there'll just be one code, 96156, that you will use for assessment as well as reassessment. So a couple important things to note. So again, we're going from an assessment and reassessment code to just one primary assessment code. Another important thing to note is that previously 96150 and 96151 were both timed codes, and you would report that in 15-minute increments. For our new assessment code, it is an untimed code, so it's an event-based code. And as you can see, it's been modeled after, if we think in the psychotherapy code set, we think of the 960791, the diagnostic interview. So it's been modeled after that, which is also an untimed code. Additionally, you'll see, and Megan mentioned this before, if we think about the elements, the required elements. In the past, the assessment and reassessment code it could include physiological monitoring, health-oriented questionnaires, and again, if we look at those, it was the EG, and it would list those out. Now with the assessment code, we have the IE, so we've got 3 primary things that must occur in order for you to use that assessment code. And again, as Megan stated, that was the health-focused clinical interview, behavioral observations, and clinical decision-making. So as we look at the health behavior, the intervention codes, they're going to include promotion of functional improvement, minimizing psychological and psychosocial barriers to recovery, and management of and improved coping with medical conditions. Again, these services emphasize active patient and family engagement and involvement. As we look now at, as we continue to look at health behavior, the intervention services may be provided to an individual. So again, this is going to follow the same pattern of codes, the HMB codes prior to the changes, where we're going to have an individual code. You can provide it in a group format, so a group of 2 or more patients. You can also provide it to a family with the patient present, or a family without the patient present. So those are going to have things, those aspects of the code set are still in line with the previous HMB code set.
There's an entirely new code structure for reporting intervention services that will go into effect on January 1. It involves a base code, which is a standalone code that describes the primary service, and then an add-on code that describes additional work and time that is associated with the primary service. Depicted here are the 3 parts that make up a typical standalone CPT code. This is also how a base code is structured. Each of the 3 parts accounts for a portion of the overall work RVU, or relative value unit, for the code. The pre-service is the activities that are performed prior to the patient arriving for the service. This includes elements such as preparing to see the patient, reviewing records, and communicating with other professionals or team members. These are basically considered non-face-to-face services. Secondly is the intra-service work. This is the actual providing of the service as described in the code descriptor. This is the face-to-face time with the patient, as well as documentation of clinical decision-making that will go into the written report. And finally, the post-service work. And this is the work that's typically performed after the patient leaves. It includes arranging for further services, communicating with the patient, the family, the referring provider, or other professionals in the team. This can be done both in writing or verbally. So as I mentioned, a typical CPT code or standard standalone CPT code is very similar to the structure of a base code. And that is what is depicted here on the slide. However, reimbursement for this type of code is inaccurate in instances where a single code is billed in multiple units, as the existing HMB codes are currently billed, to account for the total amount of time spent performing the service. Billing a base code multiple times can be looked at as something called double dipping. And the reason for that is that typically when performing a service, the pre-service and the post-service activities are performed only once. Therefore, they should only be billed for and reimbursed once using a base code. Depicted here, you will see the structure of an add-on code. And add-on codes were created to resolve the issue of double dipping. It allows that for just the intra-service work or the face-to-face time with the patient to be reported multiple times when appropriate, to accurately depict the amount of time and work that is performed by the provider. Additionally, pre-service and post-service activities have their own RVU values that go into the total work RVU for the service. For add-on codes, the RVU value of the pre and the post-service work are backed out or removed from the add-on code. Therefore, the value or RVU of this service for add-on codes is lower.
So a question that we typically received when we rolled out the new testing and neuropsych testing codes, which had a base and an add-on structure, we'd frequently receive comments like this: I'm doing the same amount of work for the entirety of the intervention. Why am I being paid less for my subsequent time performing the service? So as Megan pointed out, if we look at the top line with the base code, again, if we think about the RVU and the value of the base code, it represents pre-service work, intra-service work, as well as post-service work. When we look at the add-on codes, all it captures is the intra-service work. So as Megan said, for add-on codes, we have to back out, we have to take out the pre-service and the post-service work. And so that is why base codes will always have a higher value than the add-on codes, because the add-on codes, the pre and post, has been subtracted out of that. So later on in the presentation, we're going to show you what the RVU values are, and I'll try to refer to that again to kind of show the difference in base code and add-on codes. But again, it's important to realize the add-on codes are always going to be a little less in value because the pre and the post has had to be subtracted out of that.
Another important thing to consider when billing the new codes is the CPT time rule. For time-based codes or time-based services, CPT states that the following standards shall apply in time measurement. The first is a unit of time is attained when the midpoint is passed. And the midpoint would be the midpoint of the stated time in the code descriptor for the service you're providing. This means that for a 30-minute code, you have to provide a minimum of 16 minutes of service in order to be able to bill for the 30-minute code. Similarly, when you're talking about a 15-minute code, such as the add-on codes, you must perform a minimum of 8 minutes of service to meet the requirement to bill for a full unit. These are the rules that you need to attend to and document as you utilize these new codes moving forward. For example, when performing individual intervention, if the psychologist takes a total of 38 minutes to complete the service, then you can bill 1 unit of the base code, or CPT code 96158, for the first 30 minutes of service, and then 1 unit of the add-on code, CPT code 96159, for the additional time that it took to complete the service. However, if the total time for the individual intervention was only 37 minutes, then you can only bill 1 unit of the 30-minute base code because you did not meet the minimum requirement of 8 minutes to bill an additional unit of the add-on code. These rules apply to all time-based intervention services in the new code set. However, it is important to pay close attention to the units of time that are stated in each of the code descriptors, as they vary from 15 to 30 minutes. So beginning on January 1, the existing code that is used to report H&B individual intervention will be deleted and replaced with a new set of codes. Those two codes are CPT code 96158, health behavior intervention for an individual, face-to-face for the initial 30 minutes, which is the base code, and then CPT code 96159 for the add-on code, which is used to report each additional 15 minutes increment of time to perform the service.
So in this slide, this is another crosswalk that shows on the left-hand side the current H&B individual intervention code 96152, which is what you bill for that in 15-minute increments. And then on the right-hand side, you see the new base and add-on code structure. So 96158 is will be the new base code for the individual intervention. And then 96159 will be the add-on code, excuse me, the add-on code for health behavior intervention for an individual. Again, as Megan said, what determines how many add-on units is the total amount of time. And again, you got to follow the time rules that she just reviewed. So moving on, we've discussed the individual intervention group. Now we're going to discuss the HBAI group code. CPT code 96153, which is the current health and behavior group code, effective January 1, 2020, will be deleted. Beginning in January 2020, it will be replaced again with a base code and add-on code structure. The new base code will be 96164. One important thing to note, just like the intervention code, the base code has been increased from 15 minutes to 30 minutes. So just like the intervention code, for group code, for all the other intervention codes, you're going to have a base code of 30 minutes and then an add-on code of 15 minutes. So here 96164 represents the 30-minute base code, and then 96165 represents the 15-minute add-on code.
And as Stephen stated, here depicted on the slide is the crosswalk for the existing health and behavior group intervention code, and then the two new codes for health behavior group intervention that will be used beginning January 1, 2020. And I would like to note that as previously billed with the 96153 code, 96164 and 96165 should be billed for each individual patient in the group. So it will not be billed for the entire group, but each patient in the group should have their own set of codes and the appropriate units billed for their individual service. And moving on, in January, you will now no longer report health behavior intervention for family when the patient is present with 96154. Instead, you will report it with the new base and add-on code for family intervention when the patient is present. Those codes are 96167 for the first 30 minutes, and then 96168 for each additional 15-minute increment of time that it takes to perform and complete the service.
And here you have, again, you have the crosswalk, which shows on the left-hand side the current code for the family health and behavior with the patient present, 96154. And on the right-hand side shows you the two new codes, the base code 96167 and the add-on code 96168. And again, this is for when the patient is present. If the patient is not present, There'll be another code that you would use for that, which we'll cover in the next set of slides. So again, effective January 1, 2020, the current code for health and behavior intervention face-to-face without the patient present, which is 96155, that will be deleted. That code will be replaced, again, following the same pattern, will be replaced with two codes, a base code 96170 and an add-on code 96171. Again, this follows the same pattern. The base code is 30 minutes, and then you have 15-minute increments for the add-on codes. Just a thing to note here that's important, this code, without the patient present, in the current code structure, we know across lots of payers, there's discrepancies. Some payers will not reimburse for this code. We are hoping that more payers will now adapt and allow for reimbursement for this code in the future.
And again, here we show the crosswalk for the existing or 2019 H&B family intervention services without the patient present, and then the new codes, their descriptors, and that should be used for family intervention services that are provided on or after January 1, 2020. And as Stephen mentioned, reporting of these codes does not require the patient to be present. However, services offered when the patient is not present are typically not covered by Medicare. However, if the patient is present, remember to refer back to CPT codes 96167 and 96168.
In this next section, our presenters will share with you some resources for the 2020 Health Behavior Assessment and Intervention Code family.
Throughout this webinar series, we have reviewed all of the new CPT codes, the code descriptors, the RVU values, as well as the crosswalks for reporting the new HBAI services beginning on January 1, 2020. For your convenience, all of this information has been compiled into their own individual resources and are found on the reimbursement section of the APA website. That website is above the first link reported. We strongly encourage you to go and visit this site, download these resources, and begin familiarizing yourself as well as your staff with the new codes so that you're fully prepared to implement the new code set come January 1.
In addition to the current resources that we have available, we will be producing additional publications, new information and resources to assist you and your staff with making the transition and implementing the new HBAI codes that will go into effect in January. So specifically, one resource that is under development and will be coming your way in the near future, we are developing a health behavior assessment intervention billing and coding guide. This will be similar to the guide that was developed for the psychological testing and neuropsychological testing services. So we're in the midst of developing that, and we'll get that out and available. That will be available to not only members, but we'll also make that available to payers as well. Additionally, after the webinar and as questions start to come in, we will we'll have frequently asked questions and we'll respond to that, as well as additional resources will be forthcoming.
Thank you for viewing our webinar series on the new HBAI family of codes. And thank you to our presenters for sharing this important information to help us all prepare for 2020. APA Services, Inc. is available to help members with any health insurance or managed care issues, whether this involves private or government insurers. For issues related to billing codes and Medicare, or any questions regarding the content of this webinar series, please contact the Office of Healthcare Finance at ohcf@apa.org. For issues with Medicaid or private insurers, please contact the Office of Legal and Regulatory Affairs at praclegal@apa.org. If you are unsure of who to direct your questions to, you can also reach out to the Office of Healthcare Finance and they will help direct you to the right person. Thank you and have a great day.